I'm going to try to get through my part of the teaching in about between 30 and 35 excuse me, minutes so that I can take questions from you. But thank you for trusting me. Thank you for jumping on here. I look forward to giving you some great information. The last time I did this, which was last week, we had 9 people on, and a lady from Northern Ireland, or I don't know if it was Northern Ireland or Ireland, wrote in at the end, said, Dean, I learned more in this hour than I have in the last 6 months going to specialist after specialist after specialist and paying for consultations with specialists around Northern Ireland. So I can guarantee you that I'm going to be giving the same information, maybe in a little bit different way, because I just sort of have an outline of notes that I'm going to be going through. But I want to be able to make it worth your $10. And if it's not worth your $10 at the end, feel free to let me know. I'll reimburse you the $10 because I don't want to take your money and not give you something that you are needing. If I were allowed to ask a question, my question would be, is there a good stretch to help that? Ah, gotcha. I will have to answer her separately, but I'm going to go ahead and get started. Please feel free, if you guys have questions while I'm going through this, either jot them down for yourself or put them in the chat. I'll probably complete what I have to say. Then whoever asks the first question in the chat will get the first answer from me. But a lot of times when I'm going through these things, people start, questions just pop into their head, or they might have had burning questions beforehand. So please feel free, don't be shy to put those things in the chat. And the only dumb question, just in case you are thinking that you're asking a dumb question, the only dumb question is the one that you forget to ask. And I can guarantee you, if you're thinking of a question, it's most likely because other people are as well, and they might be more shy than you. So go ahead and feel free to ask it, because you're probably going to make a lot of people happy that you had the guts enough to ask it. So just as a reminder, what we are going to be covering today is, first topic is going to be, why are you still suffering? And I know you guys are going, Dean, you don't even know me. How do you know the answer to that? When I give you the answer, you'll go, hey, maybe he does know me and he does understand. Number 2, why most treatments are merely Band-Aids to the problem. Number 3, 3 things that are required for the body to heal. Oops, I forgot one, the middle one in there. What are the best exercises for you to do for this condition? And honestly, I don't care what the cause and the underlying root cause is of the problem. That makes me very different from most physical therapists or professionals, because everybody wants to go, if we don't treat the root of the problem, you'll never get it fixed. And I have an alternative way of thinking of that for you. So hopefully you will lend me an ear on that. 3 things that are required for your body to heal. And lastly, what you should look for in a health provider. So for those of you who have no clue who I am and think, why does this Yahoo online think that he can help me? Here's why I think I can help you. And I know I can help you because since I turned to an online platform, I've been helping 95 to 98% of my clients. I've given 4 people their money back out of 650 who have purchased my online course. I've given 7 people out of 1,200 who did 7 people out of 1,200 people who did a consultation with me their money back. So I don't hesitate to give money back when people don't feel like they got what they needed. Obviously, I can't guarantee that if you follow what I tell you, you're going to get relief, because I'm not with you 24/7. I don't know what you're doing the rest of the time, but I do know, after being a physical therapist for 31 years and practicing in the way I have been over the last 15 years, that I am pretty confident, no matter what the underlying cause of your problem is, whether you've had 7 past back and hip surgeries like Johnny Allen, who I helped, whether you just started with your pain within the last 2 or 3 weeks, like Teresa up in the top left corner of my screen has. You are the same Teresa O'Brien we just spoke the other day, correct? Okay, good. I was missing the middle name from the Facebook group, and I'm going, okay, I'm pretty sure, and it looks like you. So, and I've helped people who, an administrator or a moderator on my group, her name is Tina White. her story is 20-year history of back issues. She was seeing a chiropractor pretty much weekly. She was seeing her doctor every 6 months for cortisone, steroid injections, simply so that she can continue to function. You guys know what it's like to have pain. And just for the record, I'm going to tell you, I'm not against medications. I'm not against injections. I'm not against anything that can help calm down your pain. But what I am against is you or anybody else depending on those things to live and to heal. Because number one, there is no medication out there that is all natural that is going to heal you. And what we've been learning and what I've been learning is you start taking medication and depending on medication and depending on medication, it's going to affect organs in your body. It's going to affect the way you think. It's anything that's not 100% natural has some poison in it to your body, for a lack of better terminology, but it's true. So I've been a physical therapist 31 years. Over the first 15 or so years of my career, I really struggled with helping my sciatica clients. 15 to 20% of them thought I was a miracle worker and were amazed at the fact that they got better with what I was doing. And now looking back, I'm amazed that they got better with what I was doing, because I was doing the normal cookbook, what you learn in school approach and what all the back and sciatica gurus teach you. And that is, hey, you know what? When you have a tight muscle, if that butt and that hamstring muscles are tight, what do you got to do to loosen that tight muscle? You got to stretch it. So you've got to take a tight muscle, pull it tighter, and hope that it gets looser. Now, I hope you heard the sarcasm and the snarkiness in there, because that's what it was intended to be. Because if you take anything that's tight, make it tighter, how in the world does that get looser? Except supposedly in the human body, that's what supposedly happens. But many of you have probably experienced, hey, you know what? It really hurts when I try to stretch this painful leg or this painful butt. And you know why? Because it's irritated and aggravated. And what you're doing is you're irritating it and aggravating it further. So after learning a new approach about 15 years ago, that 15 to 20% success rate for my sciatica clients immediately jumped to 65 to 75%. And over the last 15 years, I've been perfecting my protocol, perfecting the way I do things, and nothing is perfect. But at this point, it's as good as I can get it. And I'm still learning day in and day out different things and different techniques within what I'm doing. And so hopefully my 95 to 98% will soon be 98 to 99%. And about 4.5 years ago, I sold the 2 clinics that I had left in Charlotte, North Carolina, just simply because in the middle of COVID, I realized, hey, you know what? I don't want to deal with insurances anymore, because anybody who lives in the States knows insurance rules the medical world, and it's not right. And the medical system is not the problem in this country. It's the insurance system, the way it's all set up. And there's all these little monopolies, and they're in cahoot. Well, you know what? I don't need to get into all the reasons why I think it's a problem, but the way things are set up, there's not a medical doctor out there that really doesn't want to help you, but we are really hamstrung being told what we can and cannot do because of what your policy has. So that's why I decided, hey, you know what? I'm out of this insurance game. I started an online Facebook group about 4.5 years ago, which now has about 16,700 people in it, of people who are not getting the relief and the results that they want, with the majority of people from the United States, Canada, the UK, and Australia. And there's quite a few from the Philippines, quite a few from some Middle Eastern countries as well. But I realized that everybody treats the same way. And that's a problem, because if I can have 16,000 people in my group, and I'm in a couple other sciatica groups that have more than that, some less than that, and I'm looking going, there are probably 100,000 people that I can have contact with that are getting treated the same way and getting the same results, which leads people to take classes like this and look for help elsewhere. So hopefully you will learn something today that you haven't learned, and I'm going to jump right on into why you are still suffering. One of 3 reasons from my perspective. Number 1, you're getting the wrong treatments. All right. Bottom line, hey, if you continue to do what you've always done, you're going to continue to get what you've always gotten. And that has led you to desperation and reaching out to somebody online. So I am sorry, but a lot of the treatments that are out there, the medication treatments, the three things that I have listed under why are you still suffering, the wrong focus of the exercises that you're doing, you're getting the wrong treatment, and you're covering up your symptoms with medications. Now, like I said at the beginning, I am not against medications. I am not against people getting relief. But what I am against is people depending on medications so that they can continue to live their lives without realizing that those medications, all a medication can do for sciatica, no matter what the underlying cause, whether it's stenosis, whether it's a bulging disc, a herniated disc, a prolapsed disc, oversized ligament, some stenosis, some facet joint from SI joint problem, piriformis syndrome, a gluteal muscle problem, an upper hamstring problem, an SI joint problem. I think I said that already. But any of those things, it doesn't matter what's the cause of it. If you're taking a medication that is masking the problem, and typically the best medications that seem to work are a real strong anti-inflammatory or a steroid, which artificially, the word skipped my mind, artificially decreases the inflammation. It doesn't do anything to the underlying problem. So here you are feeling better because you're on this medication. And what do? You do things that you couldn't do when you were in pain because it's not painful now. So you're thinking you're doing okay. But if you've got a nerve that's being impinged, whether it be from whatever, no matter what reason, whether it's by a muscle, whether it's by a bone, whether it's by a disc, or whether it's being inflamed from a joint, you're aggravating that problem further and further without realizing it because the symptoms aren't there and you're just doing things that triggered the problem to begin with. So it turns into, all right, now I need a higher dose of the medication, or I need to take it more often, or I need to change the medication because what I was using is now not strong enough. So we need to try something else. And the dosage keeps going up and you just keep on poisoning your body more and more so that you continue to function and continue to irritate. Hope that makes sense. If something doesn't make sense, somebody just go like this and go, hey, can you repeat that? But another thing, the wrong focus of the exercises. When for the first 15 years of my career, I was doing the typical McKenzie exercises where you're doing the press ups. I was doing the cat camel or the cat cow, whatever you call it, where you arch and you let your back sink up and pop up on all fours. I was doing all the core strengthening exercises because God forbid, if you have a weak core, you're going to have back pain, which is totally bogus. And I've learned that if you're in a painful position and you're trying to strengthen muscles, you're really not doing yourself any favor because number one, why do you want to stabilize yourself in a position that's painful? Number two, anytime your body has any type of pain or soreness or stiffness or discomfort, your body is going to compensate for itself, which means things are going to get thrown out of balance, meaning that muscles are going to be tighter, some are going to be looser than normal. And why would you want to reinforce those abnormal muscle patterns by trying to strengthen yourself in that position? So plenty of studies out there that prove that core strength and back pain, there's no direct correlation. That being said, just like I'm not against medications, but please don't take them to mask everything so that you can function. Core strengthening is not a bad thing in and of itself, because if you have a strong core, guess what? You're going to be much more stable. But that comes after you balance out the body and calm down the pain and put your body in a position that is not aggravated. Hope that makes sense. So while you're still suffering, you're probably getting the wrong treatment for you. The exercises, if you're doing them, are probably not the ones that you should be doing, or you're covering them up with medications. Okay, you're covering up the problem with medications. Number two, why are most treatments merely Band-Aid approaches to the problem? And I'm talking about things like medications, braces, all the funky creams that you read about, the injections, TENS units, dry needling, acupuncture. I call those Band-Aids simply because none of those things get to your underlying issue. Creams, for example. Some people say, hey, I got the Voltaren cream that my doctor gave me. It's making all the difference in the world. That's awesome. You're basically putting another medication in your body. And number two, you're getting a nice skin reaction that distracts your brain from what's going on underneath. And you wind up doing things that you normally couldn't do because you're feeling better and you're just perpetuating the problem. Dry needling. I've been dry needling. I was dry needling for years before I sold my practices. And people get great relief typically right away with dry needling, but you're really not making any long-term changes. You're just sort of calming down what's already there. In the same way with acupuncture. And I know some people say acupuncture cured me, and I still scratch my head in the same way that I scratch my head in the fact that I was helping 15 to 20% of my clients way back by doing things that I know now probably didn't really help them, but for some reason they got better. So these Band-Aid approaches probably help 15 to 20% of people, and they'll swear by them, and that's totally fine. I'd much rather work with the 95 to 98% chance that I'm actually doing long-term benefit than working with the 15 to 20% of things that mask the problem and don't really get to the root of the issue. All right. A lot of things that you're doing may feel good at the moment, but can often lead to prolonged issues and prolonging the problem. And I always use the example of our bodies want to heal. That's what our bodies were created to do. When you get a cut on your arm, first thing that happens is it bleeds, it cleans out, the blood cleans out whatever is inside the area, and then it lays down a scab, and then the scab protects the cut so that it heals. But what happens when that scab itches? Oh, that feels so good to itch that scab and scratch it. What happens 20 minutes later when you look down at that scab? It's all bloody again, the scab ripped off, and what happens? You start the healing process all over again. Very similar to what all these Band-Aid approaches are doing for sciatica. If you're getting relief with medications, if you're getting relief with a brace, if you're getting relief with a cream, if you're getting relief with an injection, you feel good, and just like it feels good to scratch that itch and it relieves, what are you doing in the long run? You're irritating things further and you're setting yourself back. The third thing under this topic is most of those Band-Aid treatments do not put your body in an ideal position to heal. And what I mean by that is, I had said earlier, whenever your body has any type of tightness, soreness, pain, discomfort, irritation, the natural response of your body will be to compensate. And I always tell people, think of somebody walking around on a really bad sprained ankle. Their body's doing this to try to help the body function in as minimal pain as possible. The bottom part of your leg is doing this to protect your ankle. That whole bottom part of your leg now is out of normal function. And in order to continue to function, the rest of your body has to compensate to try to help minimize pain and minimize damage. Same thing with sciatica, with butt pain, with hip pain, with low back pain, with calf pain, with hamstring pain, with foot pain from sciatica. Although you may not be walking as crazily as somebody with a really bad sprained ankle, the body's response to that pain will be the same, and your body will compensate. And when your body compensates, bless you if you just sneezed, right, your body's going to be out of balance. And this is obviously an exaggerated out of balance, but you can see when your body's out of balance, right side versus left side, because of the compensations, your body's going to be stressed and tense. And what part of the body gets the brunt of the force from being tensed and stressed? The area that you're probably trying to protect, the weakest link. So if we don't address the body parts that are out of balance, we're going to continue to stress and have tension through our body that is not putting our body in a position to heal. I hope that makes sense. So I know everybody's here to get this question answered, and I'm going to sort of let you down slowly because I just did a video that says the 10 best exercises for sciatica, but people often don't read the top line that says, are there 10 best exercises for relief for sciatica? So my point here, the best exercises for you to do for your condition. Number one, exercises that balance out the body's imbalances. Okay. Number two, working the painful side of your body will typically just irritate that part of your body further. Number three, working what feels good and eases tension in your body is something you need to do. So basically you got to go back to the 60s, and if it feels good, do it. Because if it feels good and you're putting your body in a position of comfort, what's happening is your body's relaxing, tension is easing, and the imbalances are calming down. If you're working something that's painful and stiff and sore, your body's going to fight against it. Your body's going to compensate. It's going to cause more tension, right side versus left side, cause more imbalances, which is going to add more tension to your body, which is going to prolong the healing process. Okay. So there are no specific exercises that I can give anybody that are the best 10 exercises. But what my big focus is, I want to be able to train people who I work with how to assess their body for imbalances. And when they find the imbalances, I want them to work the part of their body and the movement that is more comfortable and less restricted. Because when you're moving your body in a position that's more comfortable and less restricted, your body's going to relax, tension is going to ease. And then to prove it, I will have you retest what was restricted to see, did it improve? Can you move further? Is there less pain? Okay. And we are going to go through a couple exercises just to show you the principles. And obviously in an hour class, I can't give a full blown program. If I did, it would cost a lot more than $10, but I'm trying to get you guys to realize, all right, if I'm stretching something that's painful, if I'm doing something that's painful, my body's protecting against itself. It's going to cause more compensations. It's going to cause more tension in my body, and it's not good for me. But if I can find positions that are comfortable, if I can move in ways that are comfortable, I can actually cause the body to balance out, calm down, relax. And what happens when your body's in an optimal position with balance on both sides, with less tension in the body can actually heal. And I don't care what the underlying problem is. Because if your body's out of balance, there's going to be tension in the area where the problem is. When your body's in balance, the tension's going to ease up. The muscles doing this are going to relax, and you're going to give your body the best chance at healing. All right? So there are 3 things that are required for any musculoskeletal problem to heal. Real simple things. Number 1, you have to have enough water intake. And in all the research that I've been doing, 60 to 70% of Americans, at least, and I'm assuming it's pretty similar around the world, 60 to 70% of Americans typically are walking around in a state of slight dehydration, meaning that they're not getting enough water intake, which means that their cells are not functioning optimally to keep inflammation down. Because when your cells are not working optimally, some of the systems of those cells are not going to be functioning at their peak. And so if inflammation is the problem, which it is for probably 70 to 80% of any sciatica client, you're not able to clean out inflammation at a normal rate. And the way to know if you're having enough water in your system is, sorry for anybody who's not in America, but if you take your weight in pounds and divide it by 2, that's how many ounces of water generally you need to keep your body hydrated enough, because we are basically 65 to 75% water. It's amazing that we don't wave around instead of walk around just because our bodies are so much water. Our brains are 80 to 85% water, I believe. And so imagine starving your brain. When you're not drinking enough water, you're starving your brain. Therefore, you can't think straight. And when people are in pain, you know what happens to their thoughts. Man, if I just cut it off, it'll feel so much better. And all the crazy things that we think about, and the stress and the anxiety that builds. So getting enough water is required for your body to heal. Number 2 is getting enough sleep. 7 to 8 hours a night is the optimal amount, because what happens is you sleep, your brain dumps, your body actually heals. You know how people say when you're going through growth spurts, you need more sleep, because you know what happens when you sleep? Your body regenerates, things grow. So if you're dealing with sciatica, you've got to try to find the most comfortable position possible to sleep, to try to get 7 to 8 hours a night so your body can start healing. And number 3, which is just as important as the other 2, you've got to learn what the triggers are to your pain. And what I mean by a trigger is I use the mnemonic AMP, A-M-P. What activities, what movements, what positions are doing this to your sciatic nerve and irritating it? Because you can take all the medications you want, you can do all the right exercises you want, but if you continue to do this to yourself or do this to yourself, no matter what you do, if you don't recognize those triggers and avoid doing them as much as humanly possible, you're going to continue to aggravate and aggravate and aggravate. All right? So lastly, what should you look for in a healthcare provider? Number one, my biggest thing is I always tell people, look for someone who understands what sciatica and its symptoms entail. Now, just for clarification, sciatica is really not a diagnosis, even though most of you have probably been diagnosed with sciatica. Sciatica is actually a symptom. And you guys know what it feels like. It can be sharp, it could be dull, it could be shooting pains, it could be just achiness, it could be numbness, tingling, it can be burning, it can be any symptom that runs along the sciatic nerve, which starts in the lower 2 lumbar vertebrae and upper 3 sacral nerve roots. They combine to form a thumb-sized, a medium-sized, thumb-sized thickness nerve that runs down the middle of the butt, down the middle of the hamstring, and then right behind the knee, it splits into 2 nerves that go down the outside portion of the leg, and then one that wraps towards the front of the leg down into the foot to the toes. All right. So sciatica is basically a generic name for any type of irritation along the sciatic nerve. And it's most usually caused by a disc problem in the lumbar spine. It can definitely be caused by piriformis syndrome. It can be caused from SI joint problems or other stenotic problems. Basically, stenosis means that the area where the nerve root is coming out of the spine is shrunk down to a smaller level, and all those things are treatable with the right approach. All right. So you want to find somebody who understands sciatica and all the specific sciatica symptoms. Number 2, you want someone who just does not throw medications at it. And most primary care doctors, most GPs, whatever you call them in your area, some people call them internal medicine docs, primary care docs, general practitioners, family docs. If they just say, hey, here's some anti-inflammatory muscle relaxer pain medication, come back in 2 weeks and tell me how you feel. Medications do not heal sciatica. Some of you have probably had back issues or back problems in the past. You got one of those 3 or all 3 of those types of medications given to you, and they took care of the problem, and you thought, hey, it healed it. Congratulations, it was a minor problem that began, but most people generally have a little bit of a backache when it first shows up, and then the backache progresses the next episode, and things generally progress over time into a full-blown sciatica case. It could take years. Some people it takes months. Some people it takes weeks. Some people, the first time they ever have a back issue, it's full-blown sciatica. So everybody's different. The causes, what triggers it can all be different. But if you have a doctor who's just throwing medications at it, they're not really trying to take care of the problem. They're just trying to knock out the symptoms and hope that the problem resolves on its own. Number 3, don't trust somebody who just gives you a generic handout. And if you've been to a doctor and they say, oh, here's exercises for sciatica, if they're not going through the exercises with you, if they're not giving you specific instructions of, oh, if this aggravates your pain, don't do it. But the exercise sheets that you can just go onto Google actually and just put in generic sciatica exercises, and you can see sheets of exercises that talk about the different press-ups, the hamstring stretch, the piriformis stretch, the cat-camel exercises, the core strengthening, the bridging, the pelvic tilts, the pelvic clocks, all the typical, the dead bug exercise that PTs and chiropractors give you that are generic. If they're not telling you what to watch out for, if they don't watch you do the exercise, if they're not assessing you and telling you what you should and shouldn't be doing, time to find a new provider. Last but not least, I always say, hey, you know what? Try to find a sciatica specialist, someone who knows sciatica inside and out, because I always liken our bodies to cars. We're not going to put diesel fuel in a gasoline car because guess what? It ruins it. If you have a carburetor issue that is a technic, I'm not a mechanic, so bear with me if this doesn't make sense, but it does in my mind. Hopefully it will in yours. If you have a specific carburetor problem and you take it to a general mechanic who does work on carburetors and has seen carburetor issues, but is not a carburetor specialist, you might be going back several times because they thought they fixed the problem the first time, the second time, the third time. Why not take it to somebody who at least works on carburetors a majority of the time and knows them inside and out? In the same way with your sciatica, I mean, I have nothing against, I have a lot of GP friends, I have a lot of family practice doc friends, I have a lot of internal medicine doc friends. I've got a lot of PT friends who see sciatica as one of the 50 or 60 diagnoses that they treat. And it's probably down in the lower 1, 2, or 3 of those 60. So basically, that's why you're getting the generic exercise and the medications, because it's sort of like, hey, see how this goes. If this doesn't work, we'll give you either different exercises, different medications, or maybe we'll send you to a different specialist, or maybe get a scan at that time. And I don't know if you guys have noticed my MRI scan videos, but I'm not a huge fan of the MRI simply because I've had so many patients that come in and their MRIs do not match their symptoms. And if you're someone who can lay down and not have pain, and you're laying down for your scan, and it comes back with all these problems that say, oh, you know what, your nerve root's being impinged by this nerve. Oh, you got stenosis. Oh, there's a pinching of your nerve, but you're laying down, not in pain, don't have any problems when you lay down, and they're telling you you have all these problems. Isn't it a little fishy that your nerves are being pinched and crunched, but you don't have any pain when you're in that position? Other people have severe pain in that position, so it may line up a little bit better. But I can't tell you how many people I know have had the worst MRIs that the doctor's ever seen, and it doesn't match up to any of their symptoms. Please know that degenerative disc disease and bulges start occurring pretty frequently and regularly in people from 30 to 35 years old. That's at 45 to 50% of those people, I believe. And then every year after that, the percentage increases. Those are people with no symptoms. So if you don't have an MRI that can compare the before and after pain, you have no idea what your back looked like before that pain started. And the problems that are seen on that MRI may have been there long before your problem started, which means they are not necessarily the cause of your problem. I have a PT friend of mine who about 17 years ago had some stomach issues, so he had a CAT scan. After the CAT scan, they sent him to an orthopedic surgeon, and he thought that's kind of weird, but he walked into the surgeon's office. The surgeon said, how in the world are you walking in here? He goes, what are you talking about? He said, I have never seen a scan like this on somebody's back. You've got some degenerative problems that are excessive for somebody who is, at the time he was in his late 40s. You have herniations that are impinging on your nerves. He started naming the 5 or 6 problems that this guy had. One of the worst MRIs he'd ever seen. And my friend looked at me and goes, I've never had a day of back problem or leg problem in my life. He goes, I was literally expecting you to come in a wheelchair because you shouldn't be able to walk with this. He goes, and that was 17 years ago. To this day, he's never had one day of problem. So MRIs, even though they can pick up a lot of things that are nefarious, I've had people who've had tumors. Those are obviously extremely, extremely, extremely rare, and that's not meant to scare you. But when things are not resolving in the way that they should when you get the right treatments, then I could totally understand, okay, hey, let's see if something is going on, whether it be a Tarlov cyst, whether it be some type of cyst on the spine that's just benign, whether there be something going on that just is not making sense. I could totally understand. So if you ever hear me say, no, because everybody on my page, well, I've got this going on. Well, have you had an MRI? And I'm like going, stop with the MRIs. If you get the right treatments, the MRI is going to be insignificant. And everybody goes, yeah, but don't you have to know what's going on? Aren't you going to treat me differently if I have a herniation versus a bulge versus stenosis? And my answer is, I'm not treating your bulge. I'm not treating your herniation. I'm not treating your stenosis, because guess what? You don't feel that. What you feel is that pain radiating down your leg, or the achiness in your hamstring, or the cramping in your calf, or that ankle pain, or that butt unrelenting pain when you try to sit. If I can clear that out and you not have any back pain, do you care if you have a bulge or a herniation or stenosis going on, if you can function normally with it? To me, I would rather knock out your symptoms, let the body balance out and take care of itself as it was previous to your MRI or previous to your pain, than think that, hey, I can fix that bulging disc by doing this, this, and this. Because guess what? Bulges and herniations do heal over time, according to most studies. And if you put your body in a position of balance and non-compensation and non-tension, guess what's going to happen? Your body will heal. And if you avoid doing the triggers, and aggravating your problem, guess what? Your body's going to heal. Does that all make sense to everybody? All right, I'm seeing nods. Yes, perfect, perfect. All right, I'm opening up the chat and I don't see any questions. You guys are a quiet bunch. If you guys don't know, at the bottom of the screen, there should be a chat, a little chat looking thing. If you have a question, feel free, or if you want to unmute yourself and ask a question. But if you do that, please tell me who you are and where you're from before you ask the question, so I either know where to look on the screen or how to address you if you're not on the screen. So Carla said, my LML side changes sometimes. Is that normal? And nobody here knows what LML stands for, but I will tell you, it stands for your looser, more comfortable, less restricted side. So basically, when you're testing different body parts of your body, and we will do this in a moment, you're always looking for the side that's more comfortable. All right, Carla, yes, it's normal. And the reason your body can change sides of what you need to exercise at any given time is because, number one, your body's going to compensate according to the activities, the positions, and the movements that you're doing. It can be totally related to the stress that your body's under. It can be related to your emotional or physical or emotional or mental stress or condition that you're under. Our bodies are compensating machines trying to keep us in the most pain-free position possible. So yes, if one time you're trying to do a trunk rotation and you're really painful to the right, the next time it may be really painful to the left and looser on the left side. All right. So Carla, good question. Okay. Now I recognize your name, Carla. So I got two people here who are actually taking my, my course already. So Anne says, why do my triggers have no pain in the moment, but result in severe pain the next day? All right, Anne, why does scratching an itch on a scab feel so good at the time, and 20 minutes later you look down and you go, ah, it killed me? All right, that's why. You may be doing something that feels good in the moment, but is putting your body in a position that it's not going to like later. And it may be the way you're getting out of that movement or position. Triggers can, when people start working out and doing things, I always tell them, look, when you start getting back to doing normal things, try doing one or two things at a time. The big thing with a lot of my clients is, I want to get back to the gym. Tell me what I can and cannot do. So I tell them, look, I don't know what you can and cannot do because, number one, I'm not going to be there with you. Number two, I don't know what you've done previously. Number three, I don't know your condition, your physical, actual condition of what you can and cannot do. But here's what I suggest. If you want to get back to doing what you used to do, number one, the first time you go back to the gym, try doing one or two things at a time for half the time that you used to do it or half the weight that you used to do. Simply because if you go back and do a full workout with 5, 10, 15 different things, and you wake up the next day in pain, you're going to have no idea which of those 5, 10, or 15 things or a combination of things aggravated you. It's similar to somebody who tells me, well, I'm seeing a chiropractor, I'm going to physical therapist, getting massage and taking the medications, and I'm doing great. I go, I said, do you know which of those things are helping you and which are hindering you? No, but all together they're doing great. I go, well, if you took the medication out of there, oh, no, I couldn't take the medication out. I'd be in pain. I said, okay, so you may not be really getting anywhere because you're doing all these things. You feel good in the moment, but you're still needing the medication to be able to function. So you have no idea what might be helping, what might be hindering, or what combinations of things are hurting or hindering you. And they makes them think for a while and they go, oh, I gotcha. I lost internet for a moment. Oh, wait, hold on one second. I'm going back. What about massage? Should I or shouldn't I? I always tell my clients, if you're going to get a massage, don't do it to the painful side. And my wife's a massage therapist. I used to do some soft tissue work. I used to do a lot of soft tissue work, trying to break up the scarring, calming down those trigger points, calming down those spasms. But the word picture that I give people, if this side of my head was sore and I went to a doctor and the doctor said, Dean, I want you to do this 25 times, 5 times a day, come back in 2 weeks. Most people would look and say, why in the world would you try doing that? So my question to a massage therapist is, if this is really sore, why do I want to do this to it? Why do I want to stretch it and dig on it? It's really going to hurt when they do it. It's going to probably feel better when they're done. In the same way, when I stop pounding my head, it actually feels better. But what happens 10, 20, an hour later? And especially, was it Anne who asked that? Yes, especially Annie, if you are someone who has a delayed onset of pain and has triggers that come, or your triggers affect you later, that massage may feel great for a day or so, but things will come back with a vengeance because you're basically just aggravating something that's aggravated. If you're going to get a massage, I often tell people, have the massage therapist test your bad side, just feel how it feels, then work the good side. Work it, then go back to the bad side and see how it feels. Number one to them and number two to you. 99 times out of 100, it's going to feel much less tender to you, and it's going to feel much more loose and supple to them. All right. Great question. Teresa said, I lost internet for a moment. I'm currently being scheduled for an MRI. Did you say it's not necessary? I don't think it's necessary, especially this early on for you. The fact that you got one, and I know this has only been 3 weeks, 2 weeks that you started hurting, 3 weeks, 2 weeks. Yeah, I mean, I'm assuming you're going to have to be paying a deductible towards it. I would say spare your money for now. And if things don't start calming down and significantly in anywhere from 2 to 4 weeks, then you can start looking at the next step. But if they come back and say, oh, you got a herniated disc, guess what? They're going to say, okay, let's do an injection right into that spot. But I think it's kind of early, but if your doctor's saying it and you feel good about it, you know what I tell people, especially females, nothing against guys, I tell females, go with your gut. And I say that to women, not to guys, because guys don't have that intuition that women have. I'm sorry, it's true. I mean, things that my wife tells me, I look and I go, how in the world? And then it comes true and I go, you crazy. You crazy. I don't get it, but she's right 98% of the time. All right, Martin, I think I have piriformis syndrome. Pain in different parts of the left butt and upper outside of the leg when I'm sitting. Doctor who did several injections of the piriformis and spine does not think it's piriformis. I work at a desk all day. I got a standing desk too, but then back hurts after a while standing. I need help. Going on for years. Martin, I'm so sorry. Keep looking at that screensaver though, or that thing, and that's going to, number one, that's going to help you more than a doctor who doesn't believe you. Number two, piriformis syndrome is usually diagnosed by a process of elimination. And one thing that you said your back usually gives you problems after a while of standing. So that generally shows that the problem is more in the back, because people with piriformis syndrome don't typically, if you have back issues, all right, how do I say this? Things usually flow downward. If you have piriformis syndrome, it usually doesn't cause back pain. But if you have a back problem, it can definitely cause piriformis syndrome or anything down below. Symptoms from nerves or symptoms from problems down low in the body typically don't cause problems higher. Saying that, I want to just say, if you've got a sprained ankle and you're walking like this, you can be injuring other parts of your body. That's not because your ankle is causing it. In the same way, your piriformis muscle is not causing problems in your low back. It may very well be, but it only happens a very small percentage of people that I've seen over the 30 years, Martin, that the piriformis syndrome is causing you to stand in such a way that is causing back problems. But typically standing and walking for piriformis syndrome clients is usually relief, because sitting is the big problem. But it can also be confused with back issues, because when you're sitting, all that pressure of your upper torso, your head, your neck, your shoulders, everything is weighing right down into that lower lumbar spine. So if you have a lower lumbar spine problem, which happens to be where the sciatic nerve comes out of, which happens to pass really close by the piriformis muscle, and the piriformis muscle is actually innervated by the lowest part of your lumbar and upper part of your sacral region. So if you're having an issue in that area, you can actually get referred pain into your piriformis muscle area and it not be piriformis syndrome. Piriformis syndrome is really rare. Only 25% of people can actually get piriformis syndrome simply because of the anatomy. And in order for a person to have piriformis syndrome, the sciatic nerve has to pierce right through the piriformis muscle. And that only happens in 20 to 25% of the population. So you got a 1/4 to 1/5 of the population that's possibly can have it. And then 99 times out of 100, piriformis syndrome is either caused by overuse from running or biking, or you've had a very nasty fall right on your bum, and it's a memorable fall that can actually cause piriformis syndrome years down the line because it can take time for the scar tissue and the irritation to build up enough to cause the problem. Hopefully that makes sense, Mr. Martin. Elizabeth, first PT appointment yesterday. The PT did everything to the side that hurts. Am I on the wrong track? Yeah, that's what I would have done 16, 17, 18, 19, 20, and up to 30 years ago. If they're doing everything to the painful side, are you feeling better today? No. It felt pretty sore when they were doing it, and you probably felt a little bit worse leaving? Yes. Horrible, horrible. I'm a lip reader now. Yes, I'm so sorry. But they're just doing what they're taught. Don't take it out on them. They mean well. I meant well. And what I do have, I'm going to actually, I can't shrink my screen. What I do offer people to get started, if you're interested in working with me, I actually do initial consultations for $50 with a money-back guarantee if you're not happy. So what I'm going to do, I'm going to put in the chat the link to my calendar. If that is of interest to you, there's absolutely no pressure. I will not think any more or less of anybody on this call. If you do or you don't take me up on it, it's just an offer that I have out there. But yes, to me, you're on the wrong track, but maybe you might be the 15 to 20% of people who respond well to that type of treatment, although it doesn't sound like you did and it didn't look like you were happy. So, but you're smiling anyway, so thank you. Hold on a second. If you're trying to talk, unmute yourself and say what you're trying to say, Elizabeth.
I'm sorry. I just wanted to know, can I copy this and paste it so I have it after we close down?
Yeah, you should be able to copy it right from there and paste it into your browser. I don't know what you're using, but if not, what I'll do when I send an email of the replay of this, I'll also include my the calendar link if you're interested in meeting with me one-on-one. All right?
Okay.
So
can you hear me
again. What's that?
I said, can you hear me right now?
I can hear you right now because you're unmuted.
Because I can't find my way back to you now.
Uh-oh.
This is the first time I've ever done anything like this. I'm sorry.
Well, you've done well. I can see you. I can hear. Everybody can see you and hear you. So now, are you on a tablet, a phone, or a computer?
Laptop.
Laptop. So on the bottom part of the screen, there should be, hold on. Oh, I can't undo anything.
The Zoom button. There you are. I got it.
All right. Look at that. You're a pro.
Okay.
All right. I'm going to try one thing with everybody right now. I'm going to try one exercise just to show you how easy it can be to balance out imbalances. All right. So what I want you to do, I want you to sit on the edge of whatever you're sitting on. So your feet are flat on the floor in front of you. See my sleep question above, Robin. Uh-oh, did I miss it? There it is. Is the sleep requirement important to achieve in one stretch, like at night, or is it? You know what? I've never had that question before. I would think if you can equal 7 to 8 hours, it's just as good as doing it straight through. But obviously the goal is to try to get it done in one. All right. And then I often get the question, wait, if I'm drinking that much water, you expect me to sleep 7 to 8 hours a night without getting up in the middle of the night? And hey, when we're over 50 and over 55, yes, we get up in the night because we got to pee. But hey, you know what? If you stop drinking the water at 6:30 or 7, so drink a lot during the day so you're peeing all day so you can sleep through the night, that's even better. All right, so sitting with your feet flat on the floor, what I want you to do, put your hands over your chest and I want you to twist as far as you can to your right side, and then twist as far as you possibly can to your left side. So for the 1, 2, 3, 4, 5, 6 people who are on screen, if you just shake your head yes or no for the questions, did you feel a difference right side versus left side? Does one side feel easier to turn to and more comfortable to turn to? Yes, Elizabeth. Yes, there. Yes, there. Yes, there. No to, is that John? John's iPhone. All right. So everybody else who said yes, except for John, I'll give you something else, John. I want all you 1, 2, 3, 4, 5 ladies to turn to the side that was looser, more comfortable, less restricted. I want you to do it nice and slowly 10 times, unless it aggravates your pain. If it aggravates your pain, I want you to stop, okay? But I want you to go 10 times to the easier side. And John, what I want you to do, I want you to go all the way to one side and then try to force yourself past where you can go one direction. Then same thing to the other side, John, and try to tell me, do they both feel identically equal? Is one side more comfortable, John? No, they're equal. All right, you're going to be a difficult one, aren't you? All right, so Mr. John, what I want you to do, hey, Martin's in the screen. All right, John, what I want you to do is I want you to cross your right ankle over your left knee. So you're sitting in a figure 4. So after you guys are done with one set of 10, I want you, you've all done a break, do another set of 10 to the same side, same exact thing that you just did, 10 more times. And I want you to lean forward, John, and tell me how that feels. And then what I want you to do is switch legs and lean forward and tell me how that feels. All right, Annie, I want you to go 10 more times to that good side unless it aggravated your pain. Okay. Oh, it aggravated your pain? Oops. What happens now when you go back to your more restricted side that you tested the first time? Better, worse, or about the same? A little bit better. Good. So, John, did you feel one side more comfortable than the other? Yes, you did. All right. So the side that's more comfortable, John, I want you to do the side that's more comfortable 10 times up and down. Okay. And now, everybody, I want you to test the side that was the more restricted, more sore side. Go back once and tell me, thumbs up if it feels better, sideways if it's the same, or thumb down if it feels worse. Better, better, about the same, better. Martin, I didn't see that. You were down below the screen there. Better, same, or worse? Same. Okay, gotcha. Sorry, I didn't realize you typed it in. All right. And Martin, if you think you have piriformis syndrome, I want you to do what John's doing. I want you to cross your right ankle over your left. Take your painful leg first, cross it over the good leg, lean forward, and that should be pretty painful. True? All right. Switch legs. Lean forward, and that should feel less painful and looser. All right, good. I'm reading your lips. I'm right. So keep the good side up, and you're going to lean forward nice and slowly 10 times and do that 2 sets of 10. Mr. John, did you finish your 10? Yes. Flip to the bad side now and see how it feels now compared to what it did before. Any change? Better. Good. So by working the side, thank you very much. I have to drop. All right, Carla, I just saw that. All right, so at least everybody on the screen, except for Martin right now, but after he's done, he should give me a thumbs up. Everybody on the screen, and hopefully those of you who are just watching without your video on, hopefully you saw how simple an exercise you can do that basically just improved your balance, because everybody on the screen at least said that when they retested the side that was stiffer or less comfortable, now it is actually improved a little bit. So now instead of being out of balance this much, you're bringing yourself back into balance, at least for that movement, okay? And that's what I mean by saying you've got to balance out those imbalances so your body can heal. Martin, after you've done those 2 sets of 10 and you went back to the painful side, did it change at all? I can't read lips that fast. I am so sorry. Here. Oh, I see you're typing.
I got you. Yeah, it's less painful on the left when I bend forward, but it hurts when I'm sitting. It's always hurting, this dull pain on the left butt cheek.
Okay, but when you retested, did it feel any differently? Were you able to go a little bit further, less pain, any change?
It feels better, less pain. When
Perfect.
I bend forward.
So I usually just give 1, maybe 2 exercises to show that, hey, you know what? When you start balancing out your body, you're starting to bring things back into balance. And it's the balance and the lack of tension and stress in your body that's going to allow your body to heal. So I hope, did everybody feel like they learned something today? Worth the $10? Good, good. Thumbs up. Yes. Awesome. What I'm going to do right after this, it might take an hour and a half or 2 to get the video rendered, put onto YouTube, and then I put it as an unlisted video. So only the people who have the link, which will be you, 15 people, will get a copy of this. If you want to watch it back, great. I will also send you a link if you wanted to work with me. I'd be honored and happy to help you, but there's absolutely no pressure whatsoever. But it's been a pleasure. And if there's anything I could do for you, you guys have my email address. Please feel free to email me questions. I try to get back to people as fast as I can. I try to do it all personally, but I'm getting busier and busier, so I can't promise that it's going to be right away. But oftentimes, if I'm online, I happen to see it and I have a minute, I will get it right back to you. But thank you guys for trusting me. And if you would do me a huge favor, I don't know what Facebook group you saw this on. I posted the class on sciatica pain, sciatica pain group, sciatica nerve pain group, and then my group, which is sciatica and piriformis syndrome relief group. If you guys gained value from it and felt it was worth it, if you would just put a little, hey, attended Dean's class, it was well worth it, you should join next time, or something, just to try to get people to realize that I'm just not somebody who's a charlatan out there not knowing what I'm talking about, and any little bit helps. So I hope you guys have a wonderful day, and thank you for joining me, and I appreciate the attentiveness. So thank you very much.